Hello and welcome to the Eating Well webinar for Bolder, Healthier Champions Plus. My name is Chloe and I'm a Public Health Officer at Birmingham City Council. In this presentation, we will be covering eating well, looking at how you can eat well yourself and support others within your community. As many people know, eating well can sometimes be a lot easier said than done. For lots of us, the food environment in which we live makes it harder for us to make healthier food choices. So, for example, factors such as how close we live to supermarkets, takeaways, and fast food outlets can make unhealthy food options the easiest choice to make. Whether it's the content of the food, the portion size, or even the risk of food having been stored unsafely, it can be difficult to eat well, even with the best of intentions. We also now have access to ultra processed foods. These include packaged baked goods and snacks, fizzy drinks, sugary cereals, and ready meals containing food additives. These foods often contain high levels of added sugar, fat, and salt, but are lacking in vitamins and fibre. Studies have shown an association between eating these foods and the risk of several health outcomes, such as obesity and cardiovascular disease. In this webinar, we discuss why and how we can eat that little bit healthier. So why do we all need to eat well? We can probably all agree that eating a healthy, balanced diet is a good thing. Following a healthy, balanced diet helps us to make sure that our bodies are getting all of the nutrients that we need to work well from day to day, and it can also reduce the risk of diseases such as heart disease, stroke, type 2 diabetes, and some types of cancer in the long term. Keeping active and eating a healthy, balanced diet can also help us to maintain a healthy weight. Now, I think it's really important to remember that there is no one size fits all healthy diet, and it's not just about eating less sugar, salt, or saturated fat, but also about what we should be eating more of. For example, more fruit, vegetables, and fibre. Everyone is different, and the principles of healthy eating can be adapted to suit you. I'll go into more detail about what makes a healthy diet a little bit later on in this webinar. Now, eating a poor diet does have a number of consequences. It directly causes premature death and disability and is in the top 3 causes alongside smoking and inactivity for this. Food-related ill health is responsible for about 10% of morbidity and mortality in the UK and costs the NHS about £6 billion annually. The UK population consumes too much saturated fat and not enough fruit, vegetables, and fibre. And this is from the National Diet and Nutrition Survey. The cost of an unhealthy workforce to the UK taxpayer has been estimated at £60 billion per year, so it's quite a big impact. The World Health Organization has suggested that people should follow these 4 rules of maintaining healthy eating habits: a tobacco-free lifestyle, regular physical activity, and an environment for social and emotional well-being, all of which constitutes a healthy lifestyle. So we're considering diet, nutrition, and caring professionals. Healthcare careers require dedication, a competent attitude, and a lifestyle fashioned around long hours and overnight shifts. With today's fast food options and easy access to processed foods, developing a healthy eating routine can be difficult even in the best of circumstances. Improvements to the retail food environment in hospitals can also have an impact on the overall nutritional well-being of staff. Published research indicates that more than 60% of staff purchase food or drinks at work in a week, and only 18% reported their overall diet as being excellent or very good. Staff feedback prioritised strategies to make healthy meals more accessible and affordable, so making these meals an easier choice to make within shift patterns and hours, for example. So there are a number of different factors which can make it harder for people to eat well, and these will vary from person to person. So we have fixed factors, which are social factors out of someone's control. We also have factors to do with food skills and knowledge, whereby some of us may have a lack of understanding or awareness of what healthy eating is, and also not have access to the correct information on how we can eat healthily. Furthermore, we also have factors which influence our food choices. So we have preferences for food and set habits which we have developed over time, which can influence our food choices. I'm now going to go into these factors in a bit more detail. With the cost of food and other household bills rising, many people are facing the prospect of food insecurity. Food insecurity is a term used to describe when someone is unable to afford nutritious and safe food, which is also socially and culturally acceptable, in order to live a happy, healthy, and active life. Evidence shows that food insecurity is bad for people's diets and physical and mental health. Here in Birmingham, there are a number of food projects, including food banks, food pantries and clubs, community cafes, and on-street feeding projects who are supporting Birmingham's residents who are experiencing food insecurity. Access to shops selling healthy foods may also be a barrier. For example, if there are a lack of travel options to supermarkets, it can make the weekly shop long and costly, and in conjunction with busy schedules, we can end up not having enough time to prepare lunches for school or for work. Reliance on others to prepare food can also be tricky. For example, we may rely on one household member to prepare our meals for a number of reasons, and this can result in the choice element of what we eat being removed. Developing cooking skills as a family can be used as a tool to express our care and to spend quality time with one another, and we can use it to reduce our dependency on pre-prepared foods. In addition, in our schools, hospitals, and workplaces, we do not have control over the food offer available. Actual material things can be a barrier too, such as what cooking facilities are available and having a big enough fridge and freezer to store things in. Cooking and eating well is possible with limited facilities. So, for example, we can cook some meals using just a kettle or microwave, such as porridge and bean chilies. Confusion around healthy eating guidance can also lead to misinformed food choices. And with so much healthy eating advice out there, it's not a surprise it can become confusing. By understanding more about how to choose food, prepare food, and what the correct guidance is, we can make better informed choices about what we eat. A lack of cooking skills and reduced food preparation knowledge are also significant barriers to the production of home cooked meals. The consequence can be eating out frequently and also avoiding the kitchen. Having this knowledge can help us towards behaviour change, increase nutrition knowledge, and showing simple ways of preparing healthy food may lead to improvements in the desire and ability to prepare healthy and well-balanced meals. I'll explain the UK's healthy eating guidance in a bit more detail later on. A number of these factors can also influence our food choices too, such as taste preferences, cultural influences in cooking, family units who have preferences for different foods, children and family who don't like healthy foods, and preferences for unhealthy foods and takeaways and those quick options. So when sharing a home or space, eating habits can become affected, and offering input into meal plans for the family unit can help us to reach a compromise. So with children, for example, it often helps to let them choose the base to the meal and then tweak the side dishes a little. Trying to get to know the family eating habits can help, and it might be a slow process, but it brings longevity in healthy eating. There are also lots of recipes available to make healthier versions of takeaway meals at home. Nutrition information labels can help you to choose healthier food options by telling us how much fat, salt, and sugar that they contain. Many supermarkets and food manufacturers now also highlight the energy, fat, saturated fat, sugars, and salt content on the front of the packaging, alongside the reference intake for each of these. Colour-coded nutritional information tells you quickly if the food has high, medium, or low amounts of fat, saturated fat, sugars, and salt. So if we go to the colours, red means high, amber means medium, and green means low. So in general, a food or drink that has all or mostly green on the label is a healthier choice. Amber means neither high nor low, so you can eat foods with all or mostly amber on the label most of the time. But any red on the label means that the food is high in fat, saturated fat, salt, or sugars, and you should limit your intake of these foods and drinks. You should try to eat these foods less often and in smaller amounts. Now on this slide here, we can see a picture of the Eat Well Guide. And the Eat Well Guide is the UK's guidance, and it shows how much of what we eat overall should come from each food group to achieve a healthy, balanced diet. So it recommends at least 5 portions of different fruit and veg per day. A portion is 80 grams of fresh, canned or frozen fruit and vegetables, 30 grams of dried fruit, 150 ml of juice or a smoothie, with only 1 portion of this counting towards your 5 a day, and also 80 grams of beans and pulses, and again only 1 portion of beans and pulses counts towards your 5 a day. Fruit and veg should account for about a third of what we eat per day, and this is also the case for starchy foods. They make up about a third of all of the food that we eat, and you don't have to avoid or restrict them because they're fattening. Instead, it's important to be aware of the total amount of starch you eat, and cutting out one food group, such as carbohydrates, can cause dietary imbalances. These foods include bread, potatoes, rice, and pasta, and when choosing these, whole grain options are the healthier choice. Dairy products and calcium fortified alternatives are the body's main source of calcium, which is necessary for the growth, development, and maintenance of healthy bones and teeth. Dairy products and alternatives are also a source of protein. Milk, cheese, cream, and milk-based sauces and yogurts can, however, have a high saturated fat content, so fat-reduced options are recommended and in small quantities. Now, protein is really important. Animal products such as meat, fish, eggs, and dairy are good sources of dietary protein. Meat and fish also provide the body with a form of iron, which is easy to absorb, and fish also contains essential fatty acids. Protein also comes from foods of plant origin, so we've got pulses, nuts, and seeds, which are all high in protein. Pulses are a very good meat alternative, whether or not you're vegetarian or vegan. So even if you do eat meat, I think it's really important to also include pulses in your diet. Some fat in our diet is essential, but most of us tend to eat too much of it. Plant-based oils like vegetable, rapeseed, and olive oil are rich in unsaturated fat, so they can help lower cholesterol and reduce the risk of heart disease. Lower fat unsaturated spreads make a good alternative to butter. Now, you can use the Eat Well guides in practical activities within community groups to understand the amount of each food group in their typical diet. So, for example, you could get like an Eat Well mat and match cards into different food groups and explore what people within your communities are eating. Other healthy eating activities include Change for Life tools, cooking classes, label reading, food demonstrations, and also food taster events. Now, the original Eat Well guide does not include food from all cultural backgrounds. In this slide, we've included images of the Eat Well guide based on cultural variations in diet, such as the South Asian Eat Well guide and the African and Caribbean Eat Well guide. Anyone with special dietary requirements or medical needs might want to check with a registered dietitian on how to adapt the guide to meet their individual needs. Furthermore, the Eat Well guide does not apply to children under the age of 2 because they have different nutritional needs to adults. And between the ages of 2 and 5, children should gradually move towards eating the same foods as the rest of the family in the proportion shown in the Eat Well guide. Now, when talking about food, it's really important to also consider eating disorders. An eating disorder is a mental health condition where you use the control of food to cope with feelings and other situations. Unhealthy eating behaviours may include eating too much or too little, or worrying about your weight and body shape. Anyone can get an eating disorder, but teenagers between 13 and 17 are mostly affected. The most common eating disorders are anorexia nervosa, which involves trying to control your weight by not eating enough food, exercising too much, or doing both. Bulimia includes losing control over how much you eat and then taking drastic action not to put on weight. Binge eating disorder involves eating large portions of food until you feel uncomfortably full. And other specified feeding or eating disorder, it's a diagnosis that people are given if their symptoms do not exactly fit the expected symptoms for any specific eating disorders, and it is the most common form of an eating disorder. Getting help early when suffering from an eating disorder is really important, and if you or someone you know needs advice, please contact your GP or Forward Thinking Birmingham. Forward Thinking Birmingham is a service that offers mental health assessment and treatment for young people aged 0 to 25, and this includes treatment for eating disorders. I'm now going to go for an example which demonstrates why healthy eating advice needs to be culturally inclusive. Now, Ty is a UK registered dietitian with postgraduate degrees in dietetics and nutrition and human nutrition. Here she highlights why official healthy eating guidance needs to include nutritious foods from all cultures represented in the UK. A few years ago, as a newly qualified dietitian, she delivered a nutrition workshop to a group of young adults from an African background. She was asked in a light-hearted manner if she would advise them to eat quinoa and kale and tell them to ditch their jollof rice, fufu and pounded yam, which are starch-based foods of the West African diet. She laughed nervously and replied no, and proceeded to show them an image of the Eat Well guide on a PowerPoint presentation slide. Another person then said, "We do not see our foods on there." She realised it would have been beneficial to show foods from the group's culture to support their ability to make healthier, informed choices, which, to be clear, in no way means giving up on the nutritious plant-based foods that they described above. This story shows how important knowledge is in eating well, especially in diverse communities. In a more recent workshop with a similar group of people, she had images of traditional foods included in her presentation slides and written resources that had cultural food examples, coupled with healthy eating guidance, portion sizes and cooking tips. She was a bit shocked when someone said to her, "I didn't know that I can still eat this," as they pointed out a picture of a fibre-rich plantain in the leaflet that she had given out. After discussion with the person, she was made aware that because some people had not seen many of their foods being represented as healthy, they automatically assumed that they were not. She also had come across people who felt like they had to give up the traditional foods they love and include novel foods to have a healthy diet. Now, it's really important that healthy eating advice needs to be culturally inclusive, and the food system team here at the council are currently researching the development of culturally diverse healthy eating guidance, and hopefully when this is ready, we'll be able to share that with you. So what can we do to help? This is where the Bolder Healthier champions come in. The Making Every Contact Count approach enables health and care workers to engage people in conversations about improving their health by addressing risk factors such as alcohol, diet, physical activity, smoking, and mental well-being. Making Every Contact count is an approach to improving health and reducing health inequalities developed by the NHS and local government that can be applied to any professional or volunteer working with citizens. Making Every Contact count uses brief and very brief interventions delivered when the opportunity arises in routine appointments and contacts. Very brief interventions take from 30 seconds to a couple of minutes. So it is about increasing confidence in communicating key healthy lifestyle messages, raising awareness of the benefits of lifestyle changes, understanding the current health issues in Birmingham, signposting support to enable you to assist individuals to make healthy lifestyle changes. And you can access free e-learning for healthcare training to support you to improve your skills. And the link for this is on the slide here. Now, your role as a Bolder Healthier champion is to talk about the effect that eating well can have in our communities, to encourage and also to encourage and support eating well. Share these health messages by distributing the information you have learned in your community. Connect people to the resources that can help them or someone they know, whether on a website or through a helpline or organisation. And finally, please feed back to us. Is the information we're sharing useful? What other information do you think would help? And what else can we do to get the message across? Is there a particular topic that you would like us to focus on in a future webinar? Bolder Healthier champions should not provide anything other than approved information and receive personal information from people. Talking should always be done with the intention of helping connect people to the right support, not taking on the responsibility of offering professional guidance. Please always use approved information and try to remain neutral. Try not to get personally involved with the people you're trying to help. Please signpost them to the correct professional. So what do you talk about? It's important that we spot people who may need your support, share the messages and encourage eating well within your communities, and promote these webinars within your network. So on this slide here, I've got a few questions that you could potentially ask. So is an expectant mum aware of the Healthy Start scheme? Can an elderly patient you care for access healthy food options? Is a single dad struggling to find time to prepare healthy meals? And does a college student have access to healthy meal options at lunchtime? These questions can spark conversations and can help you to signpost people to help that they may need. Furthermore, this is an example of how you can offer help without getting personally involved. You can offer brief and immediate support to find out what help is needed and then direct the person to the resources we have given you. So this example here uses open questions with the ask, advise, act model. And the example is a colleague who's living alone. So firstly, we need to ask some questions. So can you get all of the food you need from the local shops? Do you feel confident cooking a meal for yourself? And are you aware of the government's healthy eating guidelines? Following asking these questions, based on those answers, you could then advise. So there are local services that could help. Do you know where to access them? Do you know that there are healthy and simple recipes for one? And there's lots of information online about government recommendations. Finally, we would act. So suggest local pantries or similar resources mentioned in this presentation. Signpost them to cooking courses such as Bags of Taste, and also encourage them to read the Eat Well guide or watch the Eat Well guide video from earlier. I'm now going to talk through one more quick case study. Now, a 16-year-old has confided in their school nurse. They've been making themselves vomit during the summer holidays and have been avoiding eating regular meals. So potential responses could include acknowledging their courage for asking help, which is really important in making someone feel comfortable speaking to you. Then trying to gauge the cause of their eating problem. It might be struggling with schoolwork, anxiety, issues with friendships, issues at home. It would then be important to signpost them to their GP and forward thinking to get support along with self-help resources. It would then be important to advise them that vomiting is dangerous and can lead to a number of health issues such as weakened tooth enamel and bleeding. And it is also important to avoid charged language such as commenting on their weight. And I think it's really important that we emphasise the signposting them to professionals so they can get the support that they need. Now, Bolder Healthier Champions do the very important job of connecting people to the resources available, whether through web pages, services, helplines or voluntary organisations. As Bolder Healthier Plus champions, you'll be working with organisations who may have established referral pathways. So use this as a prompt to check out with your team and manager what pathways are there, as these may go beyond the information that we have provided. Please also ask about pathways for support for staff within your organisation. Now, Whisk is a really good app/website that I'd like to promote. It's an all-in-one app for recipe saving, so anyone can access these recipes for free. It has a meal planner, which makes it easier to achieve goals because you can plan your meal for the week ahead. You can also set up communities to share healthy recipes with others. And it's really important from a health point of view, as Whisk also calculates a health score for each recipe, with a score of 7 being the minimum to be classed as healthy. This allows you to pick and recommend recipes to people you know based on this score. It's a really good free resource to use. Healthy Start is a scheme which helps families to buy healthy food and milk. If eligible, people can be sent a Healthy Start card with money on it that can be used in some UK shops. The card can be used to buy plain liquid cow's milk, fresh frozen and tinned fruit and vegetables, fresh dried and tinned pulses, and infant formula based on cow's milk. The card can also be used to collect Healthy Start vitamins and vitamin drops for babies and young people. Healthy Start vitamins are for pregnant people, women with a child under 12 months, and children aged under 4 years old who are on the Healthy Start scheme. Birmingham Warm Spaces are a network of free-to-use warm welcome sites available across Birmingham to provide free, warm and welcoming spaces where people can come to take part in activities, access services and get practical advice and support, as well as meet members of their community. The services at each space will vary, but may include information on further support and available guidance, opportunities to participate in activities and learn new things, free internet access, computers and charging points, and a friendly environment to connect with others within the community. Budget resources include TV programmes like Eat Well for Less. Martin Lewis provides good money-saving tips advice. Jack Monroe is someone who's really good to follow for budget recipes. And there's also a link to an A to Z of food storage to reduce food waste. And I think another thing that's really important is that we ensure that all eligible benefits are claimed. Currently, about £15 billion of benefits remain unclaimed each year, and it's really important that we make people aware of all the help that they're eligible for. And there's a link to a benefit calculator on this slide. Now, the cost of living crisis has made it much more difficult for many people in Birmingham to afford food. If this is something you're experiencing or someone you know is, there are lots of different ways you can get food cheaply or for free. Food banks provide a food parcel for at least 3 days for free, and these food banks use a voucher system. You can get a voucher from different services, including advice services, social services, support workers in schools, law centres, social centres, GPs, and the Citizens Advice Bureau. There's links on these slides with how to make a food bank voucher request and also how to find a food bank within Birmingham. There are also a number of other local services, such as food clubs and pantries, where you can get cheaper food, and community cafes, where you can get a free or cheap hot meal. The Active Wellbeing Society run the Big Feed project, which brings people together over food by providing a safe, welcoming space at community cafes. People can enjoy a hearty meal whilst meeting and spending time with others in their community. The cafes offer free meals and welcome optional contributions such as donating time, money or skills. Food Cycle provide meat-free meals using surplus food in a number of locations within Birmingham. Olio and the Too Good To Go app allow you to buy unsold food from shops and restaurants at a reduced price. And Incredible Surplus intercept food and other usable materials that would otherwise go to waste from supermarkets, restaurants and other sources, and provide them to individuals and community organisations on a pay-as-you-feel basis. And finally, Your Local Pantry. If you pay a small weekly fee, and then you can collect food items worth much more, about £15 to £20. Here on this slide, we have provided a directory of resources. So as you mentioned earlier, that signposting is really important. And if someone has come to you with an issue, this is a good reference to go back to find links for things that may be able to help them. So we've got the links to NHS resources such as Eat Well and Better Health, which are available to provide information on getting a healthy, balanced diet. There's a link to healthy eating places in Birmingham and also the NHS Food Scanner app. With regards to local resources, we have Health for Life, which is a community programme aiming to make a sustained difference to healthy lifestyles in local communities across Birmingham. And we also have Food Cycle, Start Well, Active Wellbeing Society, Incredible Surplus, local pantries, and WISC, which I talked about earlier. We also have the budget resources such as Eat Well for Less, and was also the food bank links again, which are the ones that I talked about earlier. And there's also Bounce Back Food, which fights food poverty all over the UK and has several local partnerships, including Birmingham Central Food Bank and Smethwick Food Bank. This directory is also continued onto the next slide for the eating disorder services that are available in Birmingham. So we've got the Forward Thinking Birmingham and also a link to the eating disorder service with the Birmingham and Solihull Mental Health NHS Foundation Trust. Now, you are the eyes and ears of the community, and you can tell us where more help is needed and how best to provide it. Please email us or contact us through social media anytime. And our email is boulderhealthierchampions@birmingham.gov.uk. So if there's anything that you need, any different webinars you want us to run, anything we should be aware of, please drop us an email and we'll be in touch with you. We hope that you are enjoying these sessions and enjoying promoting positive health and supporting your community to improve their health and well-being. We really want to thank you for volunteering to be a Boulder Healthier Champion. Your role as a Boulder Healthier Champion is to share the information into your communities to encourage and support health and well-being. Our champions are advocates for important health messages in Birmingham by distributing this information into a wide range of communities and networks. We will support you through monthly themed webinars and also tailored resource packs. And finally, I just want to say a big thank you for joining us today. We couldn't do this without you. And if you have any questions on anything that I've talked about in this presentation, please email the team. Thank you for listening.